Your heart is dying, and you might just be its killer because you are ignoring these deadly signs. In real life, a heart attack is not as dramatic as those scenes you see in movies where a character has a heart attack, clutches his chest in pain, and falls to the ground. A study shows you could actually be awake and talking while having a heart attack. Scary, right? One thing is for sure, most people who have a heart attack become curious as to why they suddenly went from healthy to sick. Well, all these could be avoided if you stopped ignoring the chest discomfort, fatigue, and shortness of breath you feel. Well, stick around to find out the 12 deadly signs of a heart attack so you will know exactly when to see a doctor and save your heart from dying. Before that, here is something you should know. Apart from high blood pressure, obesity, and diabetes, heart damage starts when plaque builds up in the arteries, blocking an artery that supplies blood to the heart muscle. This plaque is just fat and cholesterol, and its buildup eventually cuts off the supply of oxygen and nutrients, which damages the heart's muscle tissue. Now, just like we mentioned before, the first sign of impending heart damage you may notice is number 1. Chest discomfort. This is the most common symptom of a heart attack. The discomfort, tightness, or pressure you feel in your chest is most often caused by the plaque we just explained. When it blocks your artery, oxygen can no longer flow in, and your heart muscles have to work harder, causing the pain you feel. The feeling is not the same for everyone, so if you try to compare your symptoms with those of someone who has had a heart attack, it may leave you confused. Some people describe it as an elephant sitting on them, while others would swear it was just a pinching or burning sensation in their chest that landed them in the hospital. It's probably not your heart if the pain is only very brief, or if it's a spot that hurts more when you touch it or apply pressure. You should definitely still have a medical professional examine it, or have 911 on the dial if the symptoms are more severe and persist for several minutes. For those who are worried about how to know if chest discomfort is heart-related, here it is. A heart-related chest issue comes with chest tightness, burning, fullness, or pressure. It could also be a severe or crushing pain that radiates to the shoulders, neck, jaw, back, and one or both arms. Or pain that lasts more than a few minutes, intensifies with movement, disappears and reappears, or fluctuates in intensity. Also, bear in mind that you could have heart damage or a heart attack without chest pain, and this is common among women. Speaking of women, here is a sign that they are most likely to experience. Number 2, nausea, indigestion, heartburn, or stomach pain. A heart attack can cause these symptoms in certain people, including vomiting. Compared to men, women are more likely to report this kind of symptom. According to Stony Brook Medicine, these gastric symptoms, such as an upset stomach, regurgitation, or belching, occur when the heart and other parts of the body don't get adequate blood flow. Similarly, nausea and heartburn are signs of heart failure caused by fluid accumulation around the liver and intestines, which might hinder digestion. How exactly does this happen? Well, congestion will occur when the heart cannot circulate enough blood to the kidneys. The kidneys, in turn, will not be able to filter fluid into urine. This fluid will then accumulate in other areas of the body, such as the abdomen, lungs, and legs. But do not panic. There are plenty of reasons why you could feel queasy that are unrelated to your heart. After all, it might just be something you ate. However, keep in mind that it can also occur before a heart attack. Number 3, swollen legs, feet, and ankles. This symptom is just an extension of what happens after fluid accumulation, as we explained before. But remember that swollen feet can occur for a variety of reasons, including pregnancy, varicose veins, that is, swollen veins visible beneath the skin, and a lack of activity while traveling. In some cases, it turns out that your swelling is an indication of heart failure. This could imply that your heart isn't pumping blood as efficiently as it should. When the heart can't pump rapidly enough, blood accumulates in the veins, causing bloating. Not only does that happen, but subsequent heart failure can also impair the kidney's ability to eliminate excess water and sodium from the body, resulting in bloating in the lower body. Number 4, shortness of breath. Your ability to breathe and your heart's ability to adequately pump blood are deeply connected. This is how it works. Your heart pumps blood so it may circulate to your tissues and receive oxygen from your lungs. If your heart is unable to pump blood effectively, as in a heart attack, you may experience shortness of breath. This shortness of breath is occasionally accompanied by exceptional exhaustion in women. So, if you can't go to the front door without feeling short of breath, there might be something wrong. Shortness of breath is not the only indication of heart disease. When it is, your shortness of breath may be caused by issues with the heart's valves or ability to pump blood. For example, with heart failure, fluid seeps into the lungs because blood becomes trapped in the blood vessels that transport blood from the lungs to the heart. So whatever you are experiencing could be acute, lasting a few hours or days, or chronic, lasting more than 4 to 8 weeks. If you're having difficulty breathing when you shouldn't be, you should seek medical attention. Moving on, the next deadly sign you should watch out for is number 5, dizziness or feeling lightheaded. Many things may make you suddenly lose your balance or feel dizzy. Perhaps you stood up too quickly or didn't eat or drink enough water, meaning you are dehydrated. However, you should seek medical attention as soon as possible if you have shortness of breath or chest pain, along with an unexpected unbalance. You do not want to ignore those deadly signs. That sudden, inexplicable loss of consciousness or dizziness always indicates a drop in blood pressure caused by inadequate pumping of the heart. And what causes this low pressure are blockages in the arteries. Also, heart valve issues may cause you to feel lightheaded. Number 6, fatigue and exhaustion. Make an appointment with your doctor right away if you suddenly feel exhausted or breathless after doing something you used to do without any trouble, like carrying goods from the car or climbing stairs. You should honestly care more about these kinds of big changes than we do about any minor aches or pains you may be experiencing. We are talking about severe exhaustion, not just your regular lack of sleep fatigue, like the kind you get when experiencing symptoms similar to those of persistent flu, but worse, for days. This happens when the body pumps more blood back to the heart and brain than it does to the tissues because the heart finds it difficult to pump blood there. This gets us all worked out, and the fatigue ultimately manifests as an inability to do daily activities or as an abrupt severe weakening. So if you experience extreme fatigue compared to normal, it could be an indication of cardiac problems. If you are a woman, watch out for extreme fatigue or inexplicable weakness, which may sometimes last days. They may indicate heart disease, and it is typical for women to experience extreme fatigue either before or during a heart attack. Number 7, snoring. While you sleep, it's natural to snore a little. On the other hand, snoring that is abnormally loud and sounds like choking or gasping may indicate sleep apnea. Sleep apnea is simply when you repeatedly stop breathing for a few seconds during the night while you're still asleep. This increases strain on the heart. According to a study from Emory University in Atlanta, snorers and sleep apnea victims with blocked airways have a greater chance of cardiovascular disease. These sleep problems, if you are experiencing any, may be an early indicator for diabetes and high blood pressure, two conditions that worsen heart disease. Fortunately, you have plenty of time to take action before this warning sign becomes worse. You have the chance to enhance both your quality of life and sleep if you experience these symptoms at night. If a sleep study is necessary to determine whether you have this issue, your doctor can check that. If so, you might need a CPAP machine to help you breathe more easily at night. Number 8, sweating. Sweating more than normal may be a warning sign of heart problems, especially if you are not exercising or otherwise physically active. If this is true, it means that your body sweats more to try to regulate body temperature amid the extra work your heart must put out to pump blood through clogged arteries. You should definitely see your doctor if you have clammy skin or chilly sweats. Another typical symptom for women with heart problems is night sweats. This symptom may be misinterpreted by women as a menopausal side effect. On the contrary, this may indicate a close heart attack if you awaken to find your bed sheets drenched, or if you are unable to sleep because of excessive sweating. Number 9. Persistent cough. This is typically not an indication of cardiac problems. It could be something mild or an allergy. However, you should give the issue more thought if you have heart disease or are aware that you are at risk. A persistent cough with a white or pink mucus discharge may indicate that you have heart failure. This is a result of blood leaking back into the lungs as a result of the heart's inability to meet the body's demands. Let's dissect that a little bit. When the body's blood needs are not being met by the heart, meaning the heart cannot pump adequate blood due to blockade by plaque, there could be an accumulation of fluid throughout the body, especially in the lungs. What your body does in response is try to cough out that fluid due to irritation, given that fluid should not be there. It's almost like that scenario where you drink water and it goes the wrong way. In this case, your body will keep getting irritated and your cough will persist. So you can ask your doctor to investigate the source of your cough. Number 10. Irregular heartbeat. When you're anxious or excited, it's normal for your heart to race and occasionally skip or add a beat. However, see your doctor if you've started experiencing palpitations. Known also as arrhythmias, these can include fluttering in the chest, a slow heartbeat, bradycardia, or a speeding heartbeat, tachycardia. If you have persistent palpitations or an irregular heartbeat, dizziness, shortness of breath, or any other chest discomfort or pressure, call 911. Also, an audible heartbeat might exist. It is not advisable to ignore your heartbeat, even if some people become accustomed to it and frequently change their sleeping postures to block out the thump-thump noise. Pulsatile tinnitus, the sensation of hearing your heartbeat, has been linked to heart problems. If your heart's thump-thump is inducing you to sleep, find out why by speaking with a healthcare specialist. Most of the time, these are brought on by common things, like consuming too much coffee or getting too little sleep, according to Bufalino. However, on rare occasions, it may indicate the need for therapy for a fluttering heart rhythm known as atrial fibrillation. So have your physician look at it. Number 11, skin discoloration and nail changes. Skin color changes could be an indication of heart disease. The following conditions could cause the color changes: infected blood vessels or the heart, blocked arteries, or obstructed blood vessels. This could create the possibility that you have blue or purple veins on certain areas of your body, or that your skin has a purplish or blue tone, particularly on your toes. Brown or red spots may also appear on the palms of your hands or the soles of your feet. On top of that, heart disease could show itself in or near your nails. Clubbed fingers are a sign of a heart infection or heart disease, indicated by swelling of the fingers and a downward dip of the nails. If you have reddish or purplish lines under your nails that you know aren't from an injury, this could be an indication of heart issues. The final deadly sign of heart damage on our list is number 12, migraines. In certain situations, a headache might be all that it is, a headache, but occasionally headaches can also result in heartaches. On the flip side, frequent migraines may indicate that your heart may be malfunctioning, and that is a reason to worry. Researchers have discovered a link between cardiovascular diseases and migraine, especially when the migraine symptom is aura. If you are experiencing an aura, it means you have a recurring headache that comes with other sensory abnormalities like blind spots and light flashes. According to a June study published in the American Academy of Neurology, those who experience migraines with visual or sensory disruption at least once a month are twice as likely to develop heart disease. In truth, heart issues may be worsened by circulation problems that result in excruciating headaches. So do this. Do not ignore this warning sign. Discuss the possible effects of a migraine on your heart with your doctor, because anywhere in the body where there are circulatory issues should prompt medical professionals to search for other disturbing locations. So friends, we just saw about 12 heart damage symptoms in this video. Now we know about 3 such fruits which can strengthen the health of the heart, and you can also use them in your daily diet. Number 1. Berries. Berries, those tiny powerhouses of flavor and nutrition, are a fantastic choice for incorporating into your heart-healthy diet. These little fruits come in a delightful array, from the tart pops of cranberries and blueberries to the sweet-meat, slightly tart flavor of raspberries and strawberries. But beyond their burst of taste, berries are packed with anthocyanins, a type of antioxidant with superpowers for your heart. These anthocyanins act like tiny warriors, reducing inflammation throughout your body, including in your arteries. This reduced inflammation helps keep your arteries functioning smoothly, which can ultimately help regulate your blood pressure. Anthocyanins don't stop there, though. They may also improve the way your blood vessels function, ensuring proper blood flow reaches all the vital organs in your body, including your heart. On top of their antioxidant punch, berries are also a good source of fiber, which can be another ally for your heart health by aiding in lowering cholesterol levels. So next time you're looking for a heart-smart snack, reach for a handful of berries. Number 2. Citrus fruits. Citrus fruits like grapefruits, oranges, and tangerines are sunshine-colored powerhouses when it comes to heart health. Their tangy flesh is bursting with vitamin C, a well-known antioxidant that shields your cells from damage. But vitamin C's benefits for your heart go even further. It can help lower your LDL, low-density lipoprotein, the bad cholesterol that sticks to artery walls and contributes to heart disease. At the same time, vitamin C might give your HDL, high-density lipoprotein, the good cholesterol that removes LDL cholesterol, a welcome boost. Citrus fruits are also a good source of fiber, which is another heart-healthy nutrient. Fiber helps keep you feeling full, which can aid in maintaining a healthy weight, and it can also help lower cholesterol levels by trapping it in your digestive system, so it gets eliminated from your body. And that's not all. Citrus fruits contain various beneficial plant compounds, including flavonoids like hesperidin and naringenin. These flavonoids are thought to improve the health of your blood vessels by making them more flexible and elastic, which helps regulate blood pressure and blood flow. So next time you're looking for a heart-smart snack, reach for a juicy citrus fruit. Your heart will thank you for it. Number 3. Apples, that ubiquitous lunchbox staple, are more than just a crunchy, sweet treat. They're a nutritional powerhouse that deserves a starring role in a heart-healthy diet. Packed with fiber, apples can help regulate cholesterol by trapping LDL, bad cholesterol, in the digestive system and ushering it out of the body. This friendly fiber also keeps you feeling fuller for longer, aiding in weight management, another plus for heart health. But the benefits of apples go beyond just fiber. These fruits boast a plant compound called quercetin, a natural antioxidant and anti-inflammatory agent. Antioxidants help combat free radicals, unstable molecules that damage cells and contribute to heart disease. Quercetin's anti-inflammatory properties may also play a role in reducing heart disease risk, as chronic inflammation is linked to various health problems, including heart issues. And let's not forget vitamin C, another warrior in the fight for heart health. Apples are a good source of this vitamin, which can help lower bad cholesterol and improve the function of blood vessels. So next time you're looking for a heart-smart snack, reach for an apple. With its delicious taste, versatility, enjoy them sliced, baked in pies, or even juiced, an impressive array of heart protective nutrients, the apple is a true champion of heart health. So to wrap up our video, when you visit the hospital for more information about your heart, you could ask them questions like, does heart disease require a specific set of symptoms for me to be diagnosed? Which risk factors apply to me? To what extent do changes in the skin and nails indicate heart damage? Which tests will be needed to make a diagnosis of heart damage? Early detection of heart disease makes treatment easier. If you are worried about the health of your heart or a heart disease that runs in your family, consult your physician. You and your healthcare practitioner can talk about methods to lower your risk of heart disease. Remember to always call 911 or emergency medical help if you think you might be having a heart attack. Do not forget to like our video and subscribe to our channel for more. Till then, stay healthy.